inflammation is really your immune system reacting to something, right? Some type of irritant, some type of chemical, some type of poor food. And what we know about CBD oil is it helps to balance the immune system. CBD oil, it turns down the volume on all those chemicals that we were talking about earlier when taken orally, on all those inflammatory chemicals. So again, if you could imagine all those blood vessels dilated and all these inflammatory things just rushing all over the body, CBD oil, when taken orally, it appears that it helps to turn down the volume on those chemicals. And that's huge for someone who's chronically inflamed. If you're just starting taking the CBD, get your blood work, understand the results of it, and this now might be a perfect time to make some other healthy changes in your life, right? So we're seeing tons of literature coming out on CBD for helping people to quit smoking with nicotine withdrawal, opioid withdrawal, right? So we work with our patients and we try and educate them and tell them, now is the perfect time to start that anti-inflammatory diet that you've been thinking about. Now is the perfect time to start exercising. And we describe it as CBD is going to be that little extra boost that ideally helps them do that successfully. So whenever I see someone who's just starting CBD, I want to know, look, what are you dealing with? Because let's just attack this all at once. We got this powerful, cannabinoid that we're going to give you, and we're really expecting it to go well. But if you can further support how well CBD oil works, why wouldn't you? Why wouldn't you start eating healthier now? Why wouldn't you try quitting smoking if that's something you're battling? And I think those patients see even better results than the patients that don't make those extra changes. And we know CBD oil, its effectiveness is to an extent related to the lifestyle of that individual. And whether we're talking about CBD oil or medication, if I'm taking CBD oil for sleep, but I'm having 2 or 3 cigarettes with a cup of coffee at night and a drink for dessert, you're spinning your wheels, right? How far ahead do you really expect to get? So we absolutely. Generally speaking, we're probably somewhere between 10 and 40 milligrams a day, which is pretty low. That's not asking a lot of someone. Now, depending on the person and what we're trying to accomplish for maintenance, it could be higher. But for your average person who's pretty healthy, no major issues, really no complaints, they're not on any medications for anything, we're probably between 10 and 40 a day. Myself, I usually use about 10 milligrams a day. It would be pretty standard for me. And that's a great point. I used to take more, but I decreased it over time. That's a lot of people find that's what they do. But Absolutely. 10 to 40 milligrams is our advice. Now, again, I certainly have patients who are taking a much higher maintenance dose, but I find that's a safe number. And like anything, I tell people if it's their first time trying to find that maintenance dose, start slow. Maybe you start with 5 milligrams, then maybe 10, then 20, then 30, then 40. I say just start slow, because I do have some patients who take just a few drops, 4 or 5 drops underneath their tongue a day, and that does the trick for them. So start slow. You can always add more.